Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 3-episode series with Dr. Callie Sawyer, the owner and sole provider at Sprout Family Chiropractic, where she specializes in pediatric, prenatal, and family chiropractic care. As one of only 2 chiropractors in the Fox Cities area with the full ICPA pediatric and prenatal certification, Dr. Callie is passionate about helping families grow up healthy so they can grow old happy. Dr. Callie's approach blends gentle chiropractic techniques, including the Webster technique and oral ties care, with adjunct therapies like kinesiotaping, soft tissue work, dynamic stretching, and nutritional guidance. While she specializes in babies, toddlers, and pregnant mamas, she also loves helping active older siblings, teen athletes, and families looking to optimize their health. Outside the office, she is a proud wife of 13 years and a mom of 3 active and fun kids, ages 5, 8, and 10, and can usually be found coaching youth sports, wrangling the family's 2 Labradors, or cheering on Wisconsin teams with her husband. It's time to meet Dr. Callie. Let's get started with today's episode. Hey everybody, welcome to a brand new series. We are excited to welcome Callie to the mic. Welcome, Callie.
Thank you.
So I'm excited to dive into numerous topics related around pediatric chiropractic. We're going to be talking about nutrition as well as some things for mamas. But before we jump into chiropractic and your expertise, you have some fun facts. So for those of you listening, Callie actually goes way back with Dre and I.
I was going to say, you're saying Callie. It's Dr. Callie right now.
Oh, that's
okay?
fine.
Because we just know her so well.
Yes, she is a friend of ours. We've known her for a long time, but we are also excited to hear from her professionally. So one of your fun facts I knew, and one of them I didn't. So kind of fun.
Yeah, I didn't.
But let's start with the one I knew, that you played basketball at the collegiate level. So tell us where you played and what your experience was like.
Yeah. So I had a really fun time playing basketball in high school and was fortunate enough to play in college. I traveled to Minnesota State Moorhead. I was actually there this past weekend being inducted into the Hall of Fame with all of my teammates. Yeah, all my teammates that I played with in 2004, 2005. Now, I was a freshman, so I didn't really do much, but it was really fun to see people that I hadn't seen for a really long time. So I played 2 years there, and then I transferred to UW-Eau Claire. I wanted to be closer to home. I have a sister who's much younger than me, and she was growing way too fast, so I just wanted to be a little bit closer to home, and that's where I graduated from.
That's so
and
fun.
I played college basketball there too.
Do you stay in touch with a lot of your teammates?
Definitely. Yeah. Where we hang out, our kids know each other. Kids are like similar ages too, so
fun.
It makes for really fun get-togethers at least once a year.
Mm-hmm. And then your other fun fact was that you used to competitively ride horses in middle school. So I did not know this. What types of competitions did you participate in?
I mean, they were local. Like I didn't really go anywhere, but my grandma and grandpa had a hobby farm. It's actually where the new Neenah High School is built on. Like that was kind of their land that they have, and there still is, their farm is still there. But yeah, so my grandpa had an RV. He would drive us around, and like I remember for sure going to the Winnebago County horse show, and had a couple of blue ribbons, but it was fun. It was mostly just, I love being around horses, and they're just amazing creatures. And yeah, I had a rescue horse that I rode. His name was TJ, and he was a Tennessee Walker. Yeah, it was just a really fun time. I look back really fondly at like that, and thinking about my daughter being that age, I'm like, that's so fun. I'm just so glad that I had that opportunity.
So there's different types of competitions. I've watched some barrel racing type competitions,
definitely not
but
that.
then like show type. So is that more what you were doing?
It was more the show. Yeah. So I would do like, walking, cantering, and they would judge you based on like your technique and how you could control the horse. And yeah, so it was, and again, middle school. So it was pretty laid back, but it was really fun. And like the culture of like just being around all those people all weekend long. It was great.
When was the last time you rode a horse?
Oh my gosh. Probably 7th grade. No, probably high school. I literally just said this to my daughter the other day because she said she wants to ride horses. Ooh. And I was like, well, maybe we could go together. So I don't know. Maybe that'll be something that I get into as, my time frees up just a little bit here.
Nice. Kindling some fire with your daughter. How fun would that be?
I would love it.
All right. Well, let's jump into your professional life. So at some point you decided you wanted to be a chiropractor. How did your journey begin into this field?
Yeah. So, bringing it back to basketball, one of my basketball teammates, when I was at Eau Claire, hurt her ankle really bad going into playoffs. And she went to see her hometown chiropractor who got her better within a handful of days. And she had one of her best games in our postseason that she had the whole season. I was like, well, now how did that, how did they do that? Yep. So then I just kind of looked into it, got interested in what chiropractic offers. I loved the idea of teaching. I always kind of saw myself maybe a teacher, I love coaching and all that. And I was like, well, being a provider is a coach. You're coaching people through, their day-to-day things. And so that was kind of the start of it, and started chiropractic school a few years later, and here we are.
And when did you decide to specialize in pediatrics and pregnant mamas and stuff like that?
So I remember it like it was yesterday. I just had my son, Kason, and before that I had thought, I really should understand more about chiropractic care for babies. All chiropractors have it in their scope of practice to take care of kiddos. But of course, just like any profession, there are those that specialize more, who have more training, more experience. And so I took the introductory class, which is called the Webster training, the Webster technique, with a provider, doctor named Jeannie Ohm. She's passed, but she is kind of a pioneer in chiropractic care, especially through the ICPA, the group that certifies me to work with kids. And she presented on just the impact of, along with the Webster technique, learning how to do that. She talked about just the impact of taking care of kids and what that can mean for the future. And, it was very, very inspirational. And I was like, well, I guess this is what I'm doing, because now this just lit a fire in me. So that was kind of the start of it. I always wanted to be able to take care of my kids selfishly. And then, once I kind of saw the whole picture, I was like, okay, well, that's what we're going to do.
Well, you mentioned the ICPA, and you had, you're one of two in the area that offer that or have that certification. Can you tell us a little bit more about that and why that's so special?
Absolutely. So the ICPA, like I said, is the group that certifies me to work with pregnant women, kids, and families. The Webster technique is just one weekend course. So like I said, I learned the Webster technique that first weekend. I became certified. Then there were 15 more weekend classes after that, where we learn so many different things, specific techniques for kids based on age. We learn, neurological development, what's appropriate, what we should see. The list goes on of the types of classes that we would take. And then at the end, we take an exam. So those of us who are certified have taken a full exam. That exam consists of a question from each of those weekend courses, or a question or two with lots of sub questions underneath it. And then once you complete that exam, they grade it and you have to pass. So you have to be able to cover all the topics, all the important things that they want you to know. And so, I'm one of two chiropractors in the Appleton, Neenah, Menasha area that's certified. We have quite a few in Oshkosh. We have quite a few in Green Bay. So we are actually a nice hub of chiropractors here who have that training. And then I know lots of my colleagues in the area too have training. They're just not certified.
Oh, got it.
Mm-hmm.
Well, you are the perfect person then for all the questions I have about itty bitties when it comes to chiropractic care for them. Because I think a lot of families, when you're having a baby, let's be honest, you have spent $1 million on all of the preparing for baby to come and the nursery and probably care for yourself during pregnancy. And so when people are thinking about babies, maybe going to a chiropractor right after they're born, they're like, why would I need to spend that money? Why would that be beneficial for them? They're itty bitty. They're not in pain unless maybe they're crying, have colic, then maybe that might be an indicator. So why should a baby see a chiropractor right after birth?
Great question. And luckily, because I take care of pregnant women, I get to talk to them about these things during their pregnancy. So women who come to see me, we are always having conversations. I'm fielding questions about, this and that. What I always say is, once you've had a baby, babies, if they're what I call the big three, if you have any issues with the big three, eating, sleeping, or pooping, chiropractic is a great first stop. I'm able to kind of triage what's going on, maybe dig deeper into maybe why there's feeding issues. A lot of times babies have, issues with rotation of the neck, and so that makes it harder for breastfeeding. Or maybe, baby's been born via C-section and now they don't have the good gut bacteria that they need, so maybe we recommend a probiotic. But there's lots of things that we can sort of triage or talk about if there's issues with eating, sleeping, or pooping. But I have lots of moms who bring their kiddos in just for wellness. They're like, I don't think we have any issues or concerns. We just want to have their nervous system checked. And a lot of times it's because of the communication during pregnancy about the birth process and how traumatic it is. Even if it goes well, it is still traumatic. Mm-hmm. And so it's really just starting them out, with a balanced nervous system so that they can develop and be the best versions of themselves.
I love that because, when a baby is born, they have their schedule that they see a provider, right? A medical provider, a pediatrician. But you are almost like a wellness and holistic minded provider who they can also see to ask different types of questions,
Absolutely.
Right? And guide them down maybe things that a pediatrician wouldn't necessarily be talking about. So I love that, seeing you on a regular basis with their baby and then also postpartum is going to be a great way to just set themselves up for success.
Well, I feel like seeing a chiropractor such as yourself, Callie, or, somebody who's certified and specialized in that should be normal for pregnancy and postpartum and babies too. Yeah. I mean, for everybody too, right? Yeah. I mean, we could go down that road too, but I feel like, you have the provider appointment, but it also should be chiropractor appointment.
Yeah.
As well.
Yeah. And like I kind of alluded to, part of my job is to find things or screen for things that maybe are bigger than what I can handle, yeah. Right? So I am looking for, I'm not seeing a reflex here that we should definitely have, or maybe there's something neurologically going on, but I'm really there to just help that baby, that mama be the best version of themselves and support them in a way that brings them closer to health, closer to wellness. One of the things that I do, for example, is I'll measure the symmetry of the cranium as part of my exam on a newborn. And I'll always say to the mom, or dad, if they're there, I'm not looking for circumference. That's, the size of baby's head is not something that I'm worried about. That's what the pediatrician will take care of. I'm looking for symmetry so that we can screen for plagiocephaly or brachiocephaly, something where the cranium, isn't doing what it's supposed to do or doesn't look the way that it's supposed to look. So, so my job is not necessarily to be dealing with the big concerns. That's what the pediatricians are there for, but more just to help them be the best versions they can be. Mm-hmm.
I know that you have some education in tongue ties as well. Yeah. So are you, in your screening, are you kind of helping to look for that too?
Absolutely. And we, tongue tie, information on tongue ties is still kind of in its infancy when you think about the grand scheme of things. We've been maybe studying it for a decade and we don't know, definitively a lot of things, but we do have ideas of what could happen to babies down the road if they have ties that don't get addressed. And so, yes, part of my newborn screening or my infant screening is to look for tie concerns. I have worked very closely with providers in the area, referring them out to make sure that, if I see something that I'm potentially concerned about, I won't diagnose, but I will say I think it's appropriate for you to be assessed by this person or that person, depending on what their goals are, because we have different, sort of categories of baby's failure to thrive right now. That is something we need to address now. Sometimes there's just dysfunction with nursing, and so that's of course a concern as well, but something that we can kind of work through a little bit. And then we have, babies who are maybe there's something going on there, so yeah, we have to kind of triage that a little bit too. But yeah, definitely a big part of my practice is working with those babies who maybe have a tie and then getting them in the right place, or they've had a release and then I get a referral from that provider who's done the release saying, now it's time to do some chiropractic work to help calm down the nervous system, relax the soft tissue so that they can heal and hopefully have some proper function down the road. Mm-hmm.
So going back to the chiropractic piece, I do have a question on that because if I remember correctly from my college classes, babies don't have hard bones like adults do when they're that little. Mm-hmm. So when people think about chiropractic, it's like making sure that your bones are in alignment, to make sure that your nerves are in alignment, to make sure that your nervous system is in the proper position and optimized. If babies don't have bones yet, what do your actual adjustments do and how do they like stick?
Yeah, it's a great question. So, and I do explain this to parents too, because especially if they've seen a chiropractor before, they're like, do you crack my baby? And I'm always like, I can understand why you would feel that way, especially because of social media. Thank you, TikTok, for all your videos. But adjusting babies looks so different than adjusting adults. And it is because they are mostly cartilage. They do still have the muscle tone is dictated by their brain function. And so if the brain is perceiving stress in their environment, it's going to tighten and tense muscles. So that's really what I'm looking for in babies is like, where is the baby responding with tension? That tells me where the body is perceiving stress. So that's where my evaluation is. That's where my treatment is kind of wherever those muscles are tight and tense. And you talked about how do you hold an adjustment? Well, that's no different for a baby than it is for an adult. They're both going to need to manage stressors and make sure that their brain isn't perceiving stress, or at least minimizing that, so that their muscles aren't tightening and tensing up and creating that tension that's then creating potentially issues with the nervous system. Does that make sense?
Yeah, it does. Mm-hmm. Well, and it's interesting as you're talking about stressors. It's like, well, a baby doesn't have a mortgage to pay and children to chase down the street.
Sure.
So they do have tiny stressors, though. So what might those look like? So I've heard you talk about tiny stressors before.
Yeah. Tiny stressors, I talk about being, in utero positioning. We have some petite moms who are, growing big babies. And so babies get stuck in a position for maybe longer than we want them to. Maybe their fluid levels are low. And so baby doesn't have a ton of room to move around. And that can create dysfunction in just mostly how the neck moves and functions, but and also cranial bone development. So those are stressors, just being in utero and maybe being stuck in a position. And then the birth process itself, even if everything goes well, it can still be stressful. And so it's really managing those physical stressors, but also, the baby's perception of stress once they're earthside. Mm-hmm.
What would be a benefit long-term of a kiddo getting adjusted from starting when they're little? So I think about like my son is 10 right now. Mm-hmm. If I'm consistently having him adjusted since he was little, mm-hmm. is that going to have an impact on his mental state, his physical state, more so than if I don't? Because, for somebody who's listening right now and is pregnant right now, mm-hmm. helping them understand the benefits long-term of having this in their wellness routine.
Oh, I love that question. Okay. So I would say what's great about the body is it's adaptable and it heals. And so, bringing a 10-year-old child in for chiropractic care, they still have the potential to have a beautifully functioning nervous system. How long it takes us, that would be, kind of remain to be seen. But when I get to start with babies when they're little, we get to address those stressors before they become an issue. And so the brain doesn't have to perceive. The brain does perceive the stress, but it's able to manage it better. It's able to adapt and overcome better. And so, it's not that it's bad that you would start chiropractic later. It's just you're coming from a better starting point the sooner you can start.
And you're seeing better outcomes along the way too, right?
Well, and it is hard to compare, what would that 10-year-old who's never had chiropractic care, what would they be like if they had started care early? That's kind of impossible to say. But I can tell you that when I have lots of families who utilize chiropractic care as sort of their primary care. They still have their pediatrician, they still have their providers that they see. But when they have an earache or they have a little head cold, chiropractic's kind of the first thing that they do just to balance everything out. But those kids tend not to be sick very often. They tend to be really well adapted. They're calm. As much as kids can be, right? So yeah, it's more anecdotal, I would say, the difference that I see. But both of those scenarios are huge parts of my practice. The kids that start with me right away because I got to see mom during pregnancy, and the whole family comes to see me, or somebody who's like, my child is going to be put on ADHD meds. I want to try and support them. Can you help us? And so both have huge benefits. Both have hopefully great outcomes is always the plan.
Mm-hmm. And that all ties in with that like brain body connection, right? And I know this applies to adults too, but I've heard you say something about the safety pin analogy. What is that? Because I haven't heard that explained.
Yeah. So it's kind of how I'll explain how the nervous system works to people who are maybe new to chiropractic. So, if you think about a safety pin, one side is the brain, one side is the body. When the safety pin is open, the communication isn't getting from the brain to the body. The brain's having the thoughts, having the ideas, but not getting that communication to the body. When the safety pin is closed, then that communication can happen easily. The brain is able to talk to the rest of the body, able to communicate what it needs, when, all of those things. So my job as a chiropractor is to take a brain and body that's like an open safety pin and put it back together. So through chiropractic adjustments, helping the brain and the body communicate better so that it can optimally function and be working at its best.
What last piece of advice before we finish out this episode for someone who is either pregnant right now or has a newborn or has a toddler or has, a middle-aged child and has maybe been nervous to see a chiropractor for the first time? What would you say to them to help ease their nervousness and encourage them to just come try it?
Oh, that's good. Usually people who come to see me, maybe when kiddos are a little bit older, there's a lot of times where they'll come in and say, I haven't done this because I've been nervous to do it. And all I can say is I can totally understand that. It's any sort of health profession, bringing your kiddo to somebody and starting something new can be really intimidating. At least in my office and all of my colleagues that I know who work with babies a lot, you're not going to come into a high pressure situation. You're coming in to be informed, to learn about specifically, when I do a free consult. And so when those parents, or adults come in to see me, they've already filled out their intake paperwork. So I can look at it and I can say, okay, based on your intake, these are the things that I think we can work on together, things I think we can see improvement in. But what I always say, in my first day with patients is, you're driving the train. I'm going to give you all the things I think you and or your child can do to be your best, but ultimately it's up to you to make those decisions. So I think knowing you're going to come into a low pressure situation where we want to help, but we're not going to force you to be in a position that you're not comfortable with, I think takes some of the pressure off, where parents feel like they have informed consent and they're actually making a decision about care for their child. Communication is really key in my practice and with a lot of our profession because not everybody understands what we do. So we need to make sure that they understand where we're coming from, what we're doing, so they feel comfortable and confident.
Well, and you mentioned that you offer a complimentary consult too. So that's probably just a great way to start and just ask questions. Is
Absolutely.
that typically something in person or over the phone, or how does
it can be
someone do
either?
that?
Yep. So, you can. It is just me at my practice. So a lot of my patients are, as I jokingly say, trained to schedule online. And so if you're interested in signing up for a consult, you can do that online. You can call me or text me. And then once that request comes through, then I send them the intake paperwork. They fill it out. I will give them a text saying like, hey, do you want to do this in person? Do you want to do it over the phone? If it's a little one, usually they're like, absolutely over the phone, because I would love to do that while they're napping. And then if that consult, which is complimentary and takes about 15 minutes, if that turns into a new patient visit, then I can help them schedule that right away. And we've kind of already done some of that. So it's a little bit of a shorter visit that next time. But yeah, complimentary. I'm happy to spend time talking about chiropractic and how that could potentially help that patient.
Perfect.
Yeah.
Thanks for busting some myths today
There
and
you
helping us
go.
understand how and why it can benefit our littles, especially when they're just so tiny and fragile and so fresh.
That's right.
For those of you who are listening that would like a little bit more information, Dr. Callie did write a blog article on the Motherhood Alliance website. It's called The Big 4 Reasons Your Infant Should See a Chiropractor. So you can head on over there and check it out. Callie, what is the best way to contact you? What's your website?
Yep. It's SproutFamilyChiro.com, SPROUT, FamilyChiro.com.
Perfect. We do have 2 more episodes coming up with Dr. Callie. Our next one is still going to be talking about kiddos a bit, but we're going to be changing the subject into talking about nutrition and how important that is for our kids and how that can blend with, your wellness routines like chiropractic. And then in our 3rd episode with Dr. Callie, we're going to be talking about how a Webster certified chiropractor can help you achieve the birth that you want and how it can really just help that pregnancy and postpartum process, and how she'd be a great one to reach out to about that. We will be back shortly with our next episode. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, And our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.